Symptoms of hypothyroidism. Hypothyroidism can cause fatigue, weight gain, depression, and, if left untreated, may lead to serious complications. Let's take a look at the signs of low thyroid hormone production. 1. Fatigue and muscle weakness. One of the most common symptoms of hypothyroidism is persistent fatigue, even after a good night's rest. A slowed metabolism reduces energy production efficiency, affecting muscle function and causing tiredness. Some patients report significant weakness, making daily activities like climbing stairs or carrying weights more exhausting. This condition is often accompanied by muscle pain, cramps, or stiffness, which can make movement less fluid. 2. Weight gain and difficulty losing weight. Hypothyroidism tends to slow metabolism, reducing energy expenditure and leading to mild weight gain due to fluid retention and a slight fat accumulation. Excess fat is generally distributed without a specific pattern, but following a balanced diet and engaging in physical activity can help. In patients with overt hypothyroidism, specific hormone therapy is often necessary to restore metabolic balance. 3. Dry skin and brittle hair. Hypothyroidism causes the skin to become dry, rough, and prone to peeling due to reduced sebum production and slower cell turnover. Hair tends to become thinner, brittle, and more prone to falling out, while nails may weaken and split. Using moisturizing creams, nourishing oils, and specific hair products can help alleviate symptoms, but significant improvement is primarily achieved through proper hormone treatment. 4. Sensitivity to cold. People with hypothyroidism often feel cold, even at normal temperatures, due to reduced mitochondrial activity and lower heat production in peripheral tissues. Hands and feet are particularly cold, and in some cases, numbness or tingling may occur due to peripheral neuropathy. Dressing in layers, eating warm meals, and engaging in moderate physical activity can provide temporary relief. 5. Slowed heart rate. Hypothyroidism slows the heart rate, causing fatigue, muscle weakness, and an overall feeling of low energy. In more severe cases, reduced thyroid function affects cardiac output and peripheral circulation. Additionally, fluid retention can cause swelling, particularly in the lower limbs. 6. Depression and mood changes. Low thyroid hormone levels affect brain function, increasing the risk of depression and difficulty concentrating, likely due to neurotransmitter imbalances. Many patients report fatigue and brain fog, with memory and attention difficulties. If these symptoms persist, it is essential to see a doctor. Hormone therapy can provide significant relief, but in some cases, psychological support is also beneficial. 7. Facial and neck swelling. Hypothyroidism causes the accumulation of mucopolysaccharides in tissues, leading to swelling, especially in the face, eyelids, and neck, giving a pale and heavy appearance. In some cases, the thyroid gland enlarges, causing a sensation of pressure, hoarseness, or difficulty swallowing. A thyroid ultrasound and specific blood tests can help diagnose the issue correctly and plan an effective treatment. 8. Constipation and digestive issues. A slowed metabolism also affects the digestive system, reducing intestinal motility and leading to constipation and slower digestion. Many patients experience bloating, cramps, and a heavy feeling after meals, even with a balanced diet. In more severe cases, poor intestinal activity results in persistent constipation, with hard stools and difficulty evacuating. 9. Reduced libido and hormonal problems. Hypothyroidism affects the production of sex hormones and the central nervous system, reducing sexual desire in both men and women. In women, it can cause irregular menstrual cycles, heavy periods, or longer-lasting bleeding. In men, it may lead to erectile dysfunction and decreased fertility. A blood test to measure TSH, FT4, and FT3 levels can help identify the issue and determine the appropriate therapy to restore hormonal balance. 10. Joint and muscle pain. Hypothyroidism can cause muscle stiffness, widespread pain, cramps, and a feeling of heaviness in the limbs. Joints, especially in the hands, knees, and shoulders, may become painful, making movement more difficult and less smooth. In severe cases, reduced thyroid hormone production can contribute to conditions like carpal tunnel syndrome, causing tingling and numbness in the hands. Recognizing these symptoms is the first step in addressing hypothyroidism. If you suspect you have this condition, it is essential to consult a doctor for a tailored treatment. Now, if you enjoyed this video and want to support the project, leave a comment, subscribe, or send us a super thanks. Your contribution will help us create more videos.